Welcome everyone to this introductory webinar on the science of endobiogeny course. So in this webinar, we'll learn about the theory of endobiogeny. We'll understand the science of endobiogeny course. We'll learn and apply concepts regarding spring adaptation, which will be a bonus lecture at the end of the first two parts. Let's begin. Let's talk about endobiogeny and what it is. So we're going to talk about in this section what the theory of endobiogeny is, how it works in terms of clinical endobiogeny or the practice of endobiogeny, and how it improves your approach to healing. We'll summarize with 4 essential understandings or takeaways. And then we'll briefly talk about endobiogeny versus other forms of medicine or other approaches to healing. Let's begin with the first topic in section 1, which is what is the theory of endobiogeny? When we look at traditional healing systems, especially those rooted in the global south or the Eastern Hemisphere, we see that historically these healing systems were whole systems based approaches to healing and medicine. The concepts and the language they used was related to concepts of forces and elements or doshas, as they would say in Ayurveda. In distinction to this, endobiogeny is also a whole systems-based way of thinking, but the concepts are built around physiology, which is a modern concept in terms of how we understand the specific details of how the physical body is operating. So we could say that endobiogeny is a theory of the interconnectivity of all living beings and all the elements within a living being. It's a theory of how all the elements of metabolism, physiology, perception, and psychology together maintain health and manage disease. The advantages of an endobiogenic approach are that it respects the whole person. It's rooted in contemporary science, which means it's also rooted in a contemporary language. My mentor and the co-developer of the endobiogenic teachings, Dr. Lapraz, would often say, we are a contemporary people and we need a contemporary language to characterize and express our observations of what's happening to the patient, what is the origin of their illness, and how we're going to approach the act of regulation of the internal terrain. But endobiogeny, even though it's completely rooted within contemporary science and contemporary concepts of physiology and clinical medicine and best evidence, when we come to the treatment, endobiogeny uses all available treatments, or certainly considers the possibility and the role of standard medical treatments, traditional healing modalities. Nothing is off the table in endobiogeny, because endobiogeny ultimately is a way of thinking. It's an analytical method, which is really syncretic, because even though it's rooted in a rational scientific framework, it allows and requires at some level an intuition, a doctor's experience, as well as your empirical knowledge gained through working with patients, as well as respecting and considering traditional ways of knowing. Well, let's return to the theory of endobiogeny and start to talk about the core concepts. So metabolism is key to this concept of what endobiogeny is. When we think about life it can be encapsulated in the concept of metabolism. And metabolism is holism, which is circumscribing a duality. So metabolism, if we looked at this yin-yang symbol, is the entire circle. And catabolism would be, for example, the white shape, and anabolism, which is building up or restoring, would be the black. So here we have these two constantly interacting principles, and together the balance of catabolism and anabolism is what we call metabolism. Metabolism is about the intake, transformation, utilization, and removal of food and energy and how it affects the material integration and maintenance of cells and tissues and organs. And even the concept of metabolism can also be applied to ideas, to thought, to what the central nervous system is doing, because there is deductive and inductive reasoning. And this concept of metabolism, of catabolism and anabolism, is fractal. It applies to all levels of life as we know it. Now, since we've established that life is metabolism, the constant dialectic, the interaction between a force that wants to break down or liberate, and a force that wants to build up or concretize, we need to understand how does this dialectic engagement maintain a sense of coherency? And the answer to that is through the endocrine system, the hormones. The endocrine system ensures the orderly management and progress of metabolism through these alternating activities of catabolism and anabolism. Hormones are the master regulators of metabolism because they're the only system that is ubiquitous and can regulate itself as well. They ensure the coherence, order, and a larger plan of how life materializes and maintains itself and adapts to all sorts of internal and external challenges. The endocrine system as the manager of metabolism is what allows us, for example, as human beings, to go from surviving to thriving. So if we take this unitary concept of metabolism, we have the dialectic of catabolism and anabolism, and we have the endocrine management, which directly intervenes. So the first thing I want to really demonstrate to you is the conceptual power of the theory of endobiogeny, because we've organized the various lines of hormones that you see here, what we call an axis of hormonal activity. Here we have hypothalamic hormones. In the middle, we have the pituitary hormones. And in the lower row within each box, we have the peripheral organs. And each of these families will have a name: corticotropic for those relating to the adrenal cortex and cortisol, gonadotropic, which will refer to the hormones produced in the gonads, what is commonly called the sex hormones, such as estrogen, testosterone, progesterone. But of course, these play a much bigger role in metabolism than they do in secondary sexual characteristics or in reproduction. We have the thyrotropic hormones, such as T4 and T3, and we have somatotropic hormones, such as growth hormone, insulin, glucagon, etc. Now, these various lines of hormonal activity can be understood at one level simply by how they manage different metabolites, lipids, proteins, and carbohydrates. And where they're working, is it in the interior of the cell, in the exterior of the cell, and where they play a role in terms of liberating energy, concretizing energy and structure, etc. Well, we've established that life is metabolism, which is the ceaseless interplay of catabolism and anabolism. And we've established that there's a manager which ensures the coherence of this process, which is the endocrine system or the hormones. Now, the question is, what allows the hormones to fine-tune how they manage metabolism? And the answer to that is the autonomic nervous system. So the autonomic nervous system consists of two branches, sympathetic and parasympathetic. Sympathetic includes two different types of neurotransmitters. You have noradrenaline and adrenaline, and the parasympathetic is characterized by its use of acetylcholine. So the autonomic nervous system, or ANS, assists hormones in managing metabolism. How? Because they're able to modify the intensity, the duration, the sequence or chronology of how hormones work. So now we have a triadic relationship here. Parasympathetic, if you look on the right hand of your screen, is your baseline activity. It stimulates or it leads to the expression of alpha sympathetic activity, which then leads to a discharge of adrenaline from the adrenal medulla. Adrenaline autolyses itself within a few minutes, and we return to a baseline parasympathetic activity by default. In addition to the role of the autonomic nervous system, the third critical concept I'd like to introduce you today, that is the foundation of the theory of endobiogeny, are the role of emunctories. Emunctories are the glands of detoxification and drainage. And together, the three elements, hormones, the autonomic nervous system, and the emunctories, will provide the metabolites for metabolism, and they'll allow for detoxification and drainage to prevent autointoxication. So we've talked a lot about metabolism, and the theory of endobiogeny is a theory of integrative physiology. So let's take a moment to understand what is metabolism again, what is physiology, and what is integrative physiology. So as we mentioned, metabolism is the transformation of energy and material for life. Physiology refers to all the elements, all the structural elements, all the functional elements and actions that are required for metabolism to occur. Physiology ensures the various phases of metabolism, the adaptation syndromes, basal metabolism, the metabolic input, and the waste output. So physiology includes the cardiovascular system, pulmonary system, every organ, every function, the immune system, whether they are conceptual like immunity or the immune system, or they are structural like the liver, the engagement and the utilization of all of these elements is what we call physiology. Now, integrative physiology is a conceptual approach to physiology because everything is happening all at once, but it's not happening in a chaotic way because life persists and it's quite durable, even in the face of significant or existential challenges. But the concept of integrative physiology is a way to uh, conceptualize how all of this physiology is working. And it's the understanding of what maintains the unity of all levels of function at the cell level, the tissue level, the organ level, and at the global system of a whole person. Integrative physiology allows us to characterize the multi-scaled interrelationship between different structural and functional elements. So, for example, how is a single cell communicating with the brain? For example, in the bone, cells release osteocalcin. And in addition to osteocalcin's actions on bone structure, it also directly communicates with the brain. and it's able to indicate to the brain the status of metabolism, and it's able to semi-independently stimulate different neuroendocrine combinations in order to fine-tune metabolic activity. So that would be an example of a multi-scaled interrelationship between individual cells in the bone and the brain. As a result of integrative physiology, the fruit of integrative physiology is the ability to clearly understand and characterize the origin of nearly every disorder. I just want to take a moment to illustrate this. When we think about the cause of disease in modern medicine, we're usually just actually talking about the um, mechanisms of disease at the cellular level. But because we've established that the neuroendocrine system is managing metabolism, the direction of metabolism, the duration of metabolism, we can clearly understand that mechanisms which cause the symptoms that we use to characterize disease in a Western biomedical model of medicine are not the true cause, because mechanisms themselves are the result of how these upstream neuroendocrine factors have regulated metabolism. And so the concept of in endobiogeny is not to reject or ignore the mechanistic actions which result in symptoms, but to say behind those mechanisms, above those mechanisms, upstream in a chain of events, are the grand actors of the neuroendocrine metasystem, which are ultimately responsible for disorders. And the higher up the chain of causality you go, the simpler and more elegant your treatments become. So let's put together all these concepts that we've talked about so far and demonstrate what integrative physiology looks like from an endobiogenic perspective. So we return to our unitary concept of metabolism as the expression of life. And we have our alternating catabolic and anabolic activity. And we have the management of the endocrine system. Why? Because various hormones promote more catabolic or anabolic activity at the macro level and at the cellular level, and how they affect the transcription of various proteins and other factors. But now if you direct your attention to the left side of your screen, we're going to integrate into this image you saw before, the autonomic nervous system. So here are the Greek letters for parasympathetic and alpha sympathetic. And we see that alpha sympathetic or noradrenaline is going to stimulate the hypothalamic hormones, the pituitary hormones, and in some cases directly the peripheral organs to fine tune how intensely and how long metabolism is being adapted or managed. And then there's a release of adrenaline, theta sympathetic, and then a return to parasympathetic. And remember, we talked about these emunctory organs. So we see that various organs are more closely aligned with different lines of hormones. And so when we start to think about combinations of imbalances of these three core elements of managing the terrain, we start to understand how different disorders appear. And of course, the overseer or the overlay over all of this is the concept of mind. Because the way we perceive the world, the way we perceive interactions as threatening, as assuring, as bringing safety, is going to directly impact the level of functioning of the neuroendocrine system. So let's talk about the origin of disease more specifically. Disorders are fundamentally an imbalance in these elements of physiology and metabolism that we've been talking about. When we think about hormones, we want to understand which of the four hormonal lines was the initiating hormone line for a disorder and which ones, if any, are responding to this initiating factor to create a cluster of hormonal imbalances. Second, we think about the autonomic nervous system, and we want to think about which one of these three parts, or which two or all three, are disrupted, and are they affecting the sequence, the intensity, the timing, the duration of the endocrine management and metabolism. And then we look at these emunctory organs, which we can think about in primary or secondary terms, as well as other related organs such as the spleen and other lymph nodes, as well as the pancreas. Of course, a big exception, as noted by the asterisk here, to the concept of what disorders are caused by these imbalances. Of course, when a patient has an inborn error of metabolism, that's a permanent genetic disorder. But even here, when the origin is some type of genetic dysfunction, the neuroendocrine system is always implicated because it will try to compensate for the inborn error of metabolism. And even though you may not be able to effect a cure for your patient in this case, I mean, until gene therapy perhaps is advanced enough, but you can still regulate how the neuroendocrine system and the emunctories are compensating or overcompensating or undercompensating for the inborn error of metabolism. And even with traumatic injuries, somebody is in an automobile accident or a piano falls on their head, whatever happens, there's still a response by the neuroendocrine system to deal with that trauma. And the response itself, and if it's able to successfully end or if it continues inappropriately and goes into a type of chronic response state, is still something that we can address in endobiogeny. So here's the table which you'll be able to review when you watch the video again. But we can look at different combinations of degrees of imbalance of the autonomic nervous system shown in the top line, and which hormonal line or combinations of hormonal lines are imbalanced. And then, so for example, let's just take the top line right now. When you have an excessive amount of parasympathetic activity, which favors more anabolism, or accumulation of material, and when you have an imbalance between estrogen and testosterone, when this is occurring, if the liver and gallbladder are congested and the colon is congested, there's a disorder which can appear on the skin, which is what we call acne. Now, I've not explained the full terrain, the details of which hormones, how they're imbalanced. It doesn't matter right now because when you're beginning an endobiogeny, when you have doubt, always drain. Always start by addressing these emunctories. And for a disorder like acne, which is really a complex disorder to treat, just using the plant pansy, viola tricolor, is very effective because it's going to address many of these issues over here. And it's the same thing for these other various disorders. So here's an example of how, thanks to the integrative physiologic thinking of endobiogeny, we can start to reconceptualize a plant like pansy, wild pansy, viola tricolor, and its role in acne. We can overlay the actions over this model of metabolism. So pansy can help address issues of dysbiosis in the small intestines. It drains the skin. It drains the liver and the gallbladder. It drains the lungs. It's an immune regulator. And it's a wound healer, so it can help with the scarring aspect of acne, especially cystic acne. And this is just a single plant. So, for example, do you still need to use probiotics if you're changing the diet and you're using pansy, maybe, but you could start with just diet and pansy and maybe one other plant and allow the microbiome to adjust in a dynamic and intelligent way where the body is able to readjust the microbiome and the dysbiosis without trying to force the presence of specific species. The other thing they consider is that the actions of viola tricolor or any plant which can adapt to the microbiome is going to work with the aerobic organisms in the small intestine and the anaerobic organisms in the distal small intestine and the large intestine, which actually comprise the majority of the microbiome. Whereas most of the probiotics that are developed are really are aerobic organisms, and they cannot generally deal with the anaerobic or facultative anaerobic or mixed aerobic organisms further down in the intestines. So this is a really simple example of the simplicity and the elegance of an endobiogenic approach. Now that we've established the foundation of endobiogeny, let's talk about clinical endobiogeny and how it actually works. There are four elements of endobiogenic practice: listening to the patient, examining the patient, evaluating the biomarkers and other indicators of physiology, or of course, imaging studies and other tests, and then choosing an intervention based on a rational assessment of the evidence you have about the physiologic imbalances in the terrain. Listening to the patient allows you to understand how the global physiology is expressing itself within a specific area of dysfunction. Nothing is nothing in endobiogeny, and everything is interconnected. So listening to the patient and creating a patient-centered model of care is really crucial to the success of endobiogeny. So here's again a quick example. If you know that there's acne on the chin during the with premenstrual syndrome, PMS, for example, you know that there's high testosterone. If a patient complains of having a dry mouth despite drinking a lot of water throughout the day, you know that their noradrenaline in the alpha sympathetic branch is high. You know, again, et cetera, et cetera. You can just look at these various, if someone has bloating 15 to 30 minutes after eating, you know that there's an insufficiency of digestive enzymes. And it's the microorganisms in the small intestines that are, especially in the proximal small intestine, that are over consuming nutrients that should have been broken down and absorbed. So very quickly, little things that people say, simple symptoms that they present start to have a lot of meaning for you. The second aspect of clinical endobiogeny is examining the patient, because throughout the body are clues to how the physiology is functioning. The body is a timeline of acute, subacute, and chronic imbalances. Even if you say, or you think to yourself, you know, Kamyar, I don't have time to do a full physical examination from head to toe. My patient's clothed and I only have 10 or 15 minutes to see them. That's okay. There are over 15 signs that you can detect or look for just in the oral cavity, and 15 additional signs looking at the head and neck. So let's just look at a few examples. Here's a photograph of a patient, and right away you can see that the growth of hair, this growth right here indicates strong DHEA in the adrenal gland. Assuming that she didn't pluck her eyebrows, because it doesn't look like she did by the tapering style, this fading and insufficiency of hair growth here indicates weak thyroid activity. And this broad and long chin indicates strong growth hormone activity. When you look in this child's mouth, you see the abundance of saliva, and you can understand that at least within the oral cavity, there's an elevated parasympathetic tone or vagal tone, because it's stimulating an abundant production of saliva. Or you look at this person's mouth, and right away, here are three signs. You see hepatic congestion based on how dark the blood vessels are, you can tell that there's some dysbiosis based on the white coating and that there's duodenal inflammation given the strawberry tongue here, the inflammation with the raised papillae. The third element of clinical endobogeny is evaluating the blood work. Biomarkers are going to be the focus of our discussion, but any material you have, if it's an X-ray, an MRI, electrocardiogram, it's all part of the evaluation based on the scope of your practice and your training. But biomarkers are key because they're the outcome of metabolism, which is the outcome of physiology. And remember, our goal in endobogeny is to understand the physio-metabolic imbalances at the origin of all disorders. So biomarkers are a really good tool to study this. They're objective and numerical because you measure them, they have a number associated with them, and this is the basis of how we model physiologic activity. In the Science of Endobogeny course, we'll explain exactly how we do that. But this quantification allows us to longitudinally follow the evolution of the patient. For example, if we have an index, which I'll show you later, called the allergy index, there's a numerical representation of several key factors that are related to the presence of allergies in a hyperimmune state. As you start to treat your patient, they may remain symptomatic. But if you see on repeated testing that their allergy score number is coming down, you can be assured that your treatments are working and they simply need to persist a little bit longer on the same type of treatment. And if the number has remained the same or gone up, it's important that you reevaluate your therapeutic selection or broaden the scope of your investigation. But you can very rationally do this with the longitudinal monitoring of evolution with this numerical representation of what's going on. As I already implied, they can demonstrate the efficacy of treatments or the lack of efficacy, and it allows you to objectively communicate with your colleagues. As early in my work as an instructor in endobogeny, a number of my students who were experts in Ayurveda and who had good mastery of pulse diagnosis, for example, and the same thing with my um, Chinese medicine students, they would say, it's hard to objectively characterize what we're feeling in the pulses, especially when we're trying to communicate with colleagues who are not trained in our style of medicine. And when you can present something again like the allergy report and say, here is a modeling or an estimation of the level of histamine activity or the total allergic tendency, this is an objective piece of data that can be communicated to your colleagues. We have a testing system that's called GEMMA, and this system allows you to use a functional biomarker approach to understanding and modeling the terrain. It uses proprietary algorithms we've developed to deeply understand imbalances, and these various panels or groups of evaluations can be used as for screening and prevention as a diagnostic aid or therapeutic aid. And there's a wide range of conditions that can be addressed at a much lower cost than your traditional quantitative measurements or your functional medicine tests. The GEMMA panels that we've created have an interpretation guide, an intervention guide. Where appropriate, it'll talk about different types of diets, lifestyle modifications, such as different meditative breathing techniques, environmental modifications to avoid certain toxins, for example, that could affect the thyroid. And there's a discussion section which will go review the concepts. The discussion section is really a mini course in endobiogeny. It reviews the clinical evidence, how we constructed the indexes, and where relevant, it talks about drug-drug interaction, drug-herb interaction, and herb-herb interaction to help you practice in the safest way possible. Here's some examples I'll just go over very quickly. With the adrenal balance panel, it only requires a CBC with differential. You can evaluate the tendency towards fatigue, allergies, eczema, asthma, insomnia, depressive tendencies, infections, exercise intolerance, etc. A thyroid quantitative screen is a simple test which just uses TSH, free T3, and free T4. And even if you only have two of these three, you can still run this panel. Not only can you start to understand thyroid function, such as hypothyroidism, hyperthyroidism, functional thyroid imbalances, can help you explain certain symptoms, even if the numbers are normal, because this test includes suboptimal values as well. And you can also use it to screen for the risk of metabolic disorders such as obesity and diabetes, cardiometabolic disorders, neurometabolic disorders such as mild cognitive impairment, diabetic neuropathy, etc. The spasophilia panel is, again, requires only a CBC with differential and can address many, many different disorders, which have at the heart of them spasophilia, which is this imbalance in how the autonomic nervous system functions within itself. Here's some more panels. I'll show you the allergy tendency panel. There's an immune panel, inflammatory tendency panel. There's many different levels of this, so you can do a basic inflammatory screen with a CBC with differential, or order more a higher profile of labs to get a deeper understanding to include the modeling of insulin activity, necrosis, free radicals, as well as psycho-emotional origins of inflammation. And we have anxiety panels. There's a screener panel that uses a CBC and a full anxiety panel. Here's an example of this thyroid quantitative panel that I mentioned. You see, for example, that this patient had a TSH which was elevated at 9, but if you look at their free T4 in picograms per milliliter, the value is normal at 9.7. It's flagged in light blue because it's suboptimally low within the normal range. And the free T3 is elevated. So there seems to be a bit of a paradox here. Now, the thyroid quantitative panel goes deeper by evaluating these ratios. So when you look at the TSH to T4 ratio, you find that it's high. And there's a series of recommendations: plants, drainage, minerals, amino acids, dietary interventions, and other panels you can use to further your investigation. And you'll see that the T4 to T3 ratio is actually in the optimal range of 2 to 4, but because the T4 was suboptimally low and the T3 was absolutely high, it still gives you recommendations because these individual imbalances that compose the ratio are problematic. So, for example, if your patient was already on liothyronine, it would suggest you consider a reduction in the dose. And if they're not on liothyronine or you don't want to change it, you can use different plants to address the situation. Here's an example from this thyroid quantitative panel. It automatically includes a list of the top foods to help improve the production of T4 and the regulation of TSH. That's lifestyle advice that you can share with your patient to reduce stress. Avoiding organic pollutants that can be goitrogenic, iatrogenic sources of excess iodine or blockage of iodine uptake. There's a quick reminder of the thyroid hormones and what the signs and symptoms are, if it's weak or strong, so you can correlate your findings on the blood testing with the actual clinical situation. And then there's an explanation and a discussion why these ratios, what is the evidence for their ability to predict the presence or future appearance of various types of metabolic disorders, et cetera, et cetera. The practicality of endobiogeny cannot be overestimated. If you just look at dysbiosis, for example, From a standard functional medicine perspective, you consider some symptoms, you order a stool analysis, and this might cost $300, $400, $500, and you're waiting 3 or 4 weeks for the test to come back, and your patient is still symptomatic while you're waiting for the test to come back. In endobogeny, you can ask a few questions, and in under 3 minutes, you start to understand which area of the digestive tract is implicated in the dysbiosis. You can palpate a few signs that will teach you, and you'll understand if there's dysbiosis. If that's not enough for you to start treatment, you can order a spasophilia panel level 1 and an inflammation panel, for example, and start to look at some of the um, autonomic imbalances and issues with the spleen, the liver, and the pancreas. So you see how much more of a holistic and integrative approach we're taking to the question of dysbiosis. We're not just focusing on the intestines, because the intestines exist within a network of other factors. The cost of doing the CBC with differential and running the two panels together can be as little as $25. And a CBC with differential can come back in 24 hours, and you can have a guidance if you're unsure from your history and physical of precisely how to treat this patient's dysbiosis. Do you need to know of the 100 top organisms, which ones are overgrown or undergrown? Personally, I found that 9 times out of 10 or 95 times out of 100, it's not necessary to know this level of detail because the plants are intelligent. And the intelligence of the plants, their ability to work on multiple systems, on multiple levels simultaneously, will typically allow for very good results. In my practice, only when the patient has not sufficiently responded to this approach will I order a stool analysis and do a much more systematic investigation. The choice is yours, but this is one example. I'm going to move on because of the time, but you could do the same thing for adrenal fatigue. It would cost you $15 for the blood work, and running the lab in the GEMA system as little as $15 costs you $150 or more to run salivary hormones, and you'll have to wait a week or two. The same thing with anxiety. You could measure urinary neurotransmitters and salivary adrenal hormones, probably run you $300 to $400. You'll have to wait a couple of weeks. I personally have a big problem. I'm challenged by urinary neurotransmitters because when you think about dopamine, for example, 50% of it is produced in the kidneys and not in the brain. You know, when you think about serotonin, 90 to 95% is produced in the intestines, and only 5% is produced in the brain. There's more GABA produced in the pancreas than there is in the brain. So I find it difficult to conclude that the excretion of the metabolites of these neurotransmitters in the urine can strictly or exclusively be understood to be reflecting what's happening in the brain when other peripheral organs are also producing these neurotransmitters. So we have an anxiety 3 panel, which will characterize your anxiety, give you a score, look at the balance between GABA and endorphin, serotonin activity, cerebral inflammation, brainstem inflammation, cortisol. Now, we're modeling all these things. We're not measuring them. You need an expanded panel for this, but it would probably cost you about $150 for the basic blood work and then running this. And it would probably take you about a week, maybe 10 days to have your answer. For treatment choices, the coherence that you find between the history, the physical exam, and the biomarker analysis allows you to have a truly rational selection of interventions. You no longer have to guess, oh, when is the right time to use rhodiola versus ashwagandha versus oak as a gemotherapy or ribes nigrum as a gemotherapy. The system will indicate algorithmically based on the combinations of imbalances, sometimes taking into account up to 50 different considerations to give you the most precise group of recommendations. Any type of intervention you want to use is an endobiogenic intervention. If it's IV therapy, if it's lifestyle modification, if it's plants, mushrooms, digestive enzymes, vitamins and minerals, homeopathy, acupuncture, manual therapies. There is no treatment that's not endobiogenic. Even chemotherapy and surgery are endobiogenic if you understand the reason and the need within the terrain and the patient's potential for self-healing or lack of potential for self-healing. So ultimately, what's the benefit to your practice to studying and practicing endobiogeny? Because endobiogeny is first and foremost a concept of an analytical method, it's completely transposable onto your current practice and expertise. It's not imposable, it's transposable. And you can be flexible on how much of the history, the exam, and the biomarker analysis you wish to use. There are endobogenists in various parts of the world where biomarker analysis is expensive, and they exclusively rely on history and exam. We have endobogenists who have 100% remote practice, and they don't do any examination. They rely on history and biomarker analysis. And of course, there are endobogenists who do a combination of the three. The choice is yours. Endobogeny expands your knowledge base. It brings profound insights and deep knowledge. It really transforms you. Really, when you become transformed, your practice becomes transformed. It's not just learning a few tips and tricks. It's really reconsidering everything that you thought you knew. And endobogeny helps support a transition to a more satisfying and lucrative patient-centered care model. And it helps us better address issues that were previously called unsolvable or untreatable. There's always some intervention that can be found thanks to the depth and the power of the endobiogenic analysis. So what are the four essential takeaways? Endobogeny is about combining holism and physiology. It's about evaluating metabolism, which is the basic function of the universe and all living things. It's about modeling physiology and reducing the use of costly tests that can take weeks to results and can inadvertently delay definitive care. The JEMMA panels with their interpretation and treatment guides help save you time. It's always your choice, and there's a level of explainability that helps you understand why this interpretation was made and why these treatments were proposed. But there are so many treatments proposed, it's still your choice based on your practice style and what you want to use. And finally, endobogeny promotes patient-centered care with deeper insights and a wider range of treatment options. So I'm going to show you a little animation so we can answer the question, what is the difference between endobogeny and functional medicine and other approaches? Endobogeny is systems thinking. It's a way of seeing the world and seeing yourself in the world. We have the standard biomedical approach, which is rooted in reductionist physiology, non-integrating physiology. I would say that functional medicine is a type of derivative of the standard biomedical approach. And I would say that functional medicine is really holistic biochemistry. And the reason I come to that conclusion is that in functional medicine, the number of tests that are proposed to be ordered and the number of treatments that are recommended indicates that it's not a truly integrating concept. Very often I have patients who come to me who were working with functional medicine practitioners, and based on 5 or 6 tests, they're on 30 different supplements, and they still didn't get the response that they were looking for. Functional medicine can do fantastic things, and they've really advanced the ability to engage in very specific levels of analysis of the microbiome, of biochemistry, and there are times when their approach I find is quite helpful. I just find that the simplicity and the elegance of endobogeny allows for a lot of this to no longer be necessary to engage in as a standard approach. Perhaps older than functional medicine is orthomolecular medicine, which I would call functional biochemistry. And this was promoted by Linus Pauling and other thinkers in the 70s and 80s. And here you're using mega doses of vitamins and minerals, sometimes intravenously, to forcibly move physiology in a particular type of direction. And this is not, again, not necessarily a bad thing. I myself have had a very active IV nutrition program, but to me, it was necessary for people who were so disabled and their ability to self-regulate and self-heal was so compromised that the use of an intravenous infusion of high doses of vitamins and minerals became a first step, not the only step, but the first step to rehabilitating them and then resuming the use of their digestive tract and using oral supplements. But endobogeny is rooted within the standard biomedical paradigm because it's a physiology-based approach to medicine, but it's a systems-based approach and it's integrative and integrating physiology. So ultimately, when we talk about endobogeny expanding the boundaries of medicine, this is what we're referring to because endobogeny is not rejecting standard biomedicine at all. It's the foundation of what we do. We're not rejecting functional medicine and the value of certain very detailed biochemical tests or measurements of the microbiome or of inflammatory markers or the high dose usage of various vitamins and minerals. It's understanding which patient and which treatment and for what duration of time. This is what endobogeny brings. That's why I mentioned that endobogeny is transposable and not imposable. Now, we also have pre-modern whole systems medicine, such as various East Asian medicine traditions, Chinese medicine, Korean medicine, Japanese medicine, Tibetan medicine. You have Ayurveda, you have Tib-Unani, which is like a mixture of Greek and Ayurvedic medicine and East Asian medicine. And I am profoundly respectful and honoring of these systems. There's nothing wrong with these systems at all. I have no criticism actually at all of them. What I would say the positive interaction is between the theory of endobogeny and the pre-modern whole systems medicine approaches is the ability to quantify findings that you detect on pulse and tongue, for example, using the physiologic concept. And also the ability to use a physiologic language to share results and to think about selecting plants not only based on their actions on certain elements or systems from these Asian and global South approaches to medicine, but also from a Western, or I shouldn't say Western, but an integrative physiologic approach. And a number of the Chinese medicine specialists who are also endogenous have really appreciated the ability to better collaborate and gain the respect of their family medicine or internist colleagues in working with them and working with endobogeny because they can communicate in physiologic terms what the GEMA system is showing. And that's why ultimately endobogeny encompasses and can encompass all forms of medicine. Whatever you're practicing, whatever your orientation is, endobogeny can help you organize the method of interpretation, communication, and treatment selection in a way which matches our contemporary knowledge and concepts. So when you become an endogenous, you're going to think about anxiety, for example, like this, instead of thinking it's just some problem in the brain or in the mind. And you're going to see the world in this multi-scalar way, from mitochondrial function to organ function to central regulators and the brain function to the phenomenological experience of anxiety as a human being to our role in a social network of the environment and society. Well, I've taken a little bit longer than I thought I would. I hope you don't mind me taking your time and sharing this knowledge. Let's take a few questions and then go on to talk about the Science of Endobiogeny course and then the bonus lecture. The rest of the presentation should go a little bit more quickly.
Yes, this is was great. I mean, there is no simple way to talk about endobiogeny. I think that's why we love it. It's so complex and it's all directions. And there was some issue at the beginning for the chat window. I was not able to enable it, but now it's enabled to everyone. So you can chat to the all group of people, or you can chat individually to some participants. But I have some questions, like one was about endobiogeny and artificial intelligence, because we are coming in that era. And how do you see it? Is AI a threat to us, or can we embrace it? And oh, and the Julian Barker raised their hand. So after this, we can I can enable Julian so he can speak.
Wonderful. I'm so happy to have Julian with us, one of our longtime endobogenists and a true gift and gem to the world. I want to emphasize that endobogeny was created with natural intelligence. It was created from a genius and a genius perspective, but it was created using natural intelligence and not AI. I don't think AI is a threat to endobogeny. As a matter of fact, we're working on developing tools with an AI model that we will train on our natural intelligence and endobiogenic understandings to help you interpret multiple panels in a shorter period of time and to help save you time and have even deeper insights across multiple panels. I think AI, just like the way we look at treatments, there are no bad treatments. There's only inappropriate use of treatments for a given patient or inappropriate dosing. I would say the same thing is true of artificial intelligence. AI is just a method of analyzing. And right now, AI is built on a large language model, and it's really helpful for summarizing a lot of volume of information. But I have found it extremely unreliable to discover new things in medicine because there's so many hallucinations, and it will completely make up false references, false ID numbers of articles that don't exist in PubMed at the National Library of Medicine, et cetera, et cetera. Okay.
Well, Julian, you can unmute yourself and talk.
Maybe you should go on to another question, and perhaps Julian could ask the question later.
Oh, Julian said has no mic on this computer. Okay, so you can just text the question, and we will get to that. Kamyar will make sure to answer it. Okay, so I think now we can talk about the program itself, that what we are here.
Okay. So part two of our three-part discussion today is the Science of Endobogeny course. Now that you understand the overview of endobogeny, its theoretical and its clinical aspects, let's talk about how you can um, receive the training and join the global endobogeny community. So in terms of appeal and qualifications, I think it's helpful to have an interest in holistic medicine, a desire to transform your practice style or your rhythm of life. A lot of people who come to endobogeny are starting to feel burnt out from the standard insurance-based practice. They're looking for a way to return to this patient-centered care and to really not just care for patients by checking off boxes, but caring about the patient, understanding who they are, and helping them on their health journey. Having training or exposure or familiarity with other holistic practices such as Ayurveda, homeopathy, functional medicine, etc., is also helpful in many ways, but none of these things are required because you can practice endobiogeny within a standard insurance-based practice if that's what you prefer or that's what you desire. So throughout the world, uh, medical doctors, doctors of osteopathy, nurse practitioners, physician assistants, and PhDs in life science are qualified to take the course. And in the United States, those trained in Oriental medicine, such as Chinese medicine, Japanese medicine, through a certified program, are qualified. US-based naturopaths with university degrees. In the United Kingdom, medical herbalists who are university trained would also be qualified. The Science of Endobiogeny course is a 6-month course. There's one module per month. There's 2 to 3 topics per module. There's a mix of 3 different styles that we use to respect your time and to help you maintain a work-life balance. The first is that in preparing for the lectures at the end of every month, you'll be given a schedule of reading, which is self-guided. You can read at your own pace. And there are self-assessment quizzes that will be made available in the learning resource section for you to test yourself and to make sure that you are accumulating and gaining the knowledge appropriately to move on to each subsequent subject. Then we'll have a 3-hour, typically a 2 to 3 hour didactic lecture, which goes over the reading material, and there'll be open discussion, question and answer. This material is based on volume 1 of the Theory of Endobiogeny, which is a 4-volume book series. And then there's an experiential section, which is about 2 hours. And even after the first month, in the first month with the first module, you're going to start learning how to use the GEMMA analytical system for functional biomarker analysis through case studies. After you've completed the course, there is an optional certification test that you can take and diploma that you can receive, and I'll tell you a little bit more about that. Here's an overview of the course. We start in June. If you want, in May, you can read the first chapter, and then every week we would recommend you read one of the subsequent chapters, 2, 3, and 4. This module 1 is about systems overview and the concept of terrain. So everything I presented in an hour, you can learn in more detail in the first month. There's always some optional reading if you want to go further and you want to read some perspectives that are written by other people. So for example, at the end of June, you will learn how to use the thyroid quantitative panel that I showed you, as well as the thyroid autoimmune panel, which also uses thyroid antibodies in a deeper level of analysis. In Module 2, we'll focus on the hormones of adaptation and catabolism. We'll talk about the pineal gland as a over-controller of the hormonal system, and then these primarily catabolic hormones from the corticotropic and thiotropic axis. And we'll look at the adrenal balance panel and the thyroid functional panel level 3. In module number 3, we'll look at the hormones of anabolism, and then we'll also look at how different hormonal lines link together in a process we call coupling and yoking to work in a more, so we'll have a more complicated or complex and profound way of looking at how hormones interact in the symphony of life. And here we'll introduce a brand new panel that'll be created just for this course called, well, it's called EndoCheck, but it's looking at coupling and how these hormones are interacting together. And then in the 4th module, we'll talk about the essentials of clinical endobiogeny. We'll talk about, we'll go even deeper into what I mentioned in the first hour today. which is about hormonal and emunctory associations, the process of adaptation, the art of the history, the art of the physical examination. And then there's some bonus reading that you can get into if you want. And then we will introduce again 2 new panels that'll be created just for this course, detox check and stress check, which I just put in as yoking, which is the process. In the 5th module, we'll talk about biomarker modeling in detail, and we'll start to do simple panel analysis. And in our final module, we'll get to the question of therapeutics and complex panel analysis. So here, for example, we will look at the anxiety panel level 3, which uses an expanded lab profile beyond a CBC or simple thyroid hormones. And we will combine that with an analysis of the thyroid autoimmune panel. Once you've completed the course, it's time for final exam preparation. We recommend taking a few weeks to review the module material. And the exam can be taken anytime from December 20th, 2025 through March 30th of 2026. The pass mark is 70%. You'll receive a mention of distinction if you're between 80 to 89.9%, and honors if you're at or above 90%. Now, if people join after the course has begun in June, that's okay because all of the didactic and experiential lectures are recorded. So if you are really loving the course and you tell your colleagues or your practice partners, hey, you should really take this course with me, they can still join the course. And if you're very motivated to teach yourself exclusively from the books and you want to do that, you can do that. So it's really flexible, but the exam starts from December 20th. There are 3 levels of certification. Pathway 1 is to take the multiple choice exam that I mentioned earlier, and you'll receive certification in the science of endobiogeny. There's no additional fee for this, and if you pass, you'll receive a signed and frameable diploma. The second pathway is to take the exam and write an essay reflecting on a topic that I'll personally assign to you. I'll try to make it as personal as possible. And with that, you'll receive a diploma called Certified Mastery in the science of endobiogeny. The third pathway is to take up to 24 months from the start of training, so an additional 18 months from after the course is done, to either write a monograph or to conduct a case study. And in that case, you would get a diploma called Exceptional Mastery of and Contribution to the Science of Endobiogeny. The reason for the fee is that myself and other members of our scientific department will closely work with you and assist you in finding the articles, in structuring your review or structuring your retrospective or prospective study, and providing the statistical analysis to help you prepare a manuscript for publication. So the tuition includes the course material, which is an ebook of the Theory of Endobiogeny, Volume 1. We'll provide the links and the PDFs where it's relevant to the supplemental material that you can access through the learning management system. It includes the workshops, the case studies. You also get a 6-month subscription to the GEMMA system at the level called Explorer. And if you sign up early, you can activate this early. You'll also have access to the course videos for 6 months after the course is ended, and you have the certification and the opportunity to have a diploma. So I'm going to turn it over to Brigitte to talk a little bit about the early bird specials and to show you where to go to register.
Thank you. Thank you for that. I was just responding a bunch of messages in the text chat window, and it's exciting what's happening there, and people sharing all their ideas and some questions sent to me. So before we're gonna hear, stay with us because Kamyar will give the last bit of presentation about spring adaptation, which we all want to hear because it's the time. We want to help ourselves, our family, and our
And
patients.
actually, not only is
Yes,
this bonus material for those attending today, the way I'll be presenting it, I've never taught it to my students or anyone who's ever taken our course. So this is really, really new material. I'm really excited to
it's
share.
something exclusive for us, which we
Yeah.
are excited about it. So I shared on the very top of the chat two links. One is where to sign up for the training program, and other link is where to sign up for the JAMA bio. And I will just share my screen. And I wonder, Kamir, can you see a chat window? I wonder if
I
you can
can
look
see
at
it.
some.
Yeah.
Yeah, I think if you can answer, especially Jenny's question about endobiogenics, which is old retired system. And
The endobiogenics.com system was retired about 3 years ago. So Gemma is the system you'd want to go to. That's gemmabio.com, GEMMABIO.com.
yeah, let me put this link again. This is JAMA bio. All everybody is able to register there, and who are medical professionals, of course. And this is a link for the training page, which I am on now. And this is where you can read a little bit about the program. And there's a course details. And when you go to sign up for the course, that's where the payment profile comes into. What I want to emphasize that we have early bird savings until March 15. Uh, well, let me go to the sign up for the course link, which is helpful. And also what is great that you can split the payment into two, like 1 month you pay half of the price and the other month you pay half of the price, because we need to plan our expenses accordingly. So I would encourage not to miss this chance, because the closer that program comes, then the payment will be just flat. So I would encourage to use the early bird savings and the split payment. And another thing why it's helpful to beneficial to get an early bird, because with your tuition comes a 6 months JAMA subscription program that includes a like explore functionality, and it covers like five panels that comes with a subscription. But if you sign up with the early bird, you get 2 months more of that functionality. So let's say you sign up for your course in March, and you already can start using way longer than, if you would start in June. So for that reason, the tuition, this early bird is good for, because you get more of the JAMA. And of course, the training workshops that will come with the tuition, it's with the program textbook. I know a lot of you already have Theory of Endobiogeny textbooks that purchased even 5 years ago when they were first published. And but we will provide a PDF for everyone who sign up for the course. And it's nice to have a physical copy, but PDF is very practical, and you can search it. It's easy to use as a search engine, and that's going to be our main material to go through this course. And of course, there will come an extra lectures, additional historical lectures that were given by Kamyar and Jean-Claude, much like earlier. We have that old database of old videos, and we're gonna make sure to which are still valid and like good audio and all that, to allow for people to have access to those. And like I mentioned, JAMA and some panels of your choice. So this, you would need to go to training.systemsbrg.com website. There you can read a little bit more about it, see what comes with this, early bird savings. There are also some our testimonials from our friends, colleagues, and endobiogenists you can read about. And once you go to the payment page, you can select which early bird saving you are coming to. And if you're still uncertain or you are doubting, you can schedule a call with a representative, which would be me. And I would be happy to go through all of this, whether about the course or about the JAMA, and can show how all these systems work. So links are in the chat box. I'm gonna send a video recording with all those links to you guys. You can use it, you can pass it on your colleagues, and I'll finish talking. I'll let Kamya finish with the spring adaptation because that's what we want. So,
Thank you. Brigitte, apparently I'll need you to let me activate my video once again.
okay, let me do that because I give my
But in the meantime,
mhm.
Scott Shannon, thank you so much. It's great to have you on this call. One of the brilliant holistic pediatric psychiatrists of our generation and one of my first teachers. So great to have you with us. Um, there was a comment from Anna Sanduta about being a former orthodontist and interested in the course. Anna, I would encourage you to take it. We have a number of holistic dentists who have studied with us and use endobogeny in their scope of practice, especially the history and the physical to understand. And because you spend so much time in the oral cavity, there's so many signs that you can use within your scope of practice. So I would say it's very applicable to you. And our friend Dr. Murad Kitata from Tunisia asks about who will be teaching the course. The course will be taught by myself and Dr. Adam Johnson, and I will be present for all the lectures, and I will be directly teaching the experiential workshops. Okay, I think we're caught up on all the questions. Thank you all for your kind comments. I'm so glad that you enjoyed it. And again, if you were not able to join us at the beginning, we will make a recording available to you.
Mm-hmm. Kamya, can you put the video on? Great.
Yeah.
Glad to see you
Okay.
again.
Thank you. Glad to see you too. So without further ado, let's get on to our bonus material for those of you who've been able to stay with us. Okay. So we're going to be talking about uh, cosmobiology and spring adaptation. And before I get into that, I want to mention that one of the many resources we have on our main website, systemsbrg.com, is a free publication, a scientific review called Living Systems, an Endobogeny periodical. And if you go to volume 1, issue 3, which is the issue on our relationship to the universe, cosmobiology and circadian rhythms, you can go even deeper into what I'll be presenting today. I would encourage you to do that. Okay, so let's get going with spring adaptation. Endobogeny studies all levels of life, from the subatomic, the quantum, the molecular, DNA, cellular structure, tissue structure, organs, all the systems, and ultimately how we interact with the universe around us. How can we make such a claim? Well, because we have a pineal gland, a third eye, an eye which sees light, which perceives light through the two physical eyes. And the fact that we live on a planet which rotates around an axis creates a day and night phenomenon, which changes the duration of light and darkness. And the fact that our planet revolves around a star, its sun, and it's tilted on its axis, we have seasons. So every living organism on this earth has to constantly adapt itself to day and night, and to the seasons and the changing durations of day and night and the changing of temperature. So the harmonization of the rhythmicity of life depends on the pineal gland. And through melatonin and pro-opiomelanocortin, we have the production of the two melanocyte stimulating hormones, beta and alpha. And alpha MSH, which you'll learn in the course, is more closely associated with general adaptation and dealing with things like stressors, surgery, car accidents, etc. But beta MSH is going to be implicated in seasonal adaptability and how it affects the functioning of the thyroid and the adrenal cortex. And both of these MSHs are implicated in nocturnal endocrinology. So in general, rhythms and the rhythmicity of life is key to understanding how life functions and how to reduce the incidence of disorders of rhythmicity. With this concept of cosmobiology, we can expand the notion of terrain. So we have the genotype as the foundation of the encoded messages and actions of life that are expressed as a phenotype. And then we have what we talked about in the first hour, which is the triad of the endocrine system, the autonomic nervous system, the emunctories to manage metabolism and the metabolic capabilities that are expressed through our phenotypic reality. And of course, we have the important roles of the immune system, various organs, and lymphatics. And then we have this concept of autopathogenicity, which you'll learn about in the Science of Endobiogeny course. Autopathogenicity, very briefly, would be the genetic polymorphisms which cause people to have some weakness in their adaptation to certain types of responses and which lay the foundation for major disorders in their life. And then we have the chronobiology, and we have the overlay of the central nervous system, and more broadly, the concept of mind. And then this entire meta unit of terrain, which is the organism, is constantly interfacing with an external environment, which includes pollutants and other factors which cause epigenetic modification to our genotype and the actual achieved phenotypic expression. We have historically maternal-fetal interactions, which also affect the epigenetics. We have the choices that we make in our rhythmic living or the dysrhythmic living and how we engage with the external environment. Do we stay up past midnight? Do we go on benders, drinking a lot of alcohol and partying until late at night? Do we get up too early for our body and force ourselves to stay awake, etc.? Do we not take a nap when we feel tired? These are all choices we make oftentimes in dysrhythmic living. Sometimes there are imposed choices because we have to work a night shift. We all have done that at some point as doctors. Then there's seasonality. There's the effects of cosmic rays. For example, the electromagnetic, our body has an electromagnetic component. Of course, we know that that's how CT scans are working and how EEGs and ECGs are working is because we have this electrical function. And for example, the emanations, the electromagnetic emanations from the sun are so powerful, they've been known to disrupt satellites or power stations on the Earth, and they affect geomagnetic activity, which affect us, which I'll demonstrate. And then, of course, we have the microbiome, which is an external cluster of living organisms which live within us. So they're not endogenous, but without them, we wouldn't be. And they're, of course, also affected by the external environment and the food we eat and how our food choices affect the microbiome, etc. There's also weather and geomagnetic issues. So it's in the context of all of this that we come to the question of how exactly do human beings adapt to spring, and what is there even to adapt to or adapt for? And we have diet. So I'm going to present to you now an animation which demonstrates three different factors: geomagnetic output from the earth, adrenal gland, adrenal cortex activity, and thyroid activity. Now, the adrenal and thyroid lines are conceptual because there's no units. But the geomagnetic activity I'll show you is in picoteslas, and these are real measurements that were made using a magnetometer over more than several years of measurements actually in the Baltics. So we have here, we're going to start in spring. We have this period of pre-summer adaptation. We have summer, we have pre-autumn adaptation, we have autumn, we have pre-winter adaptation, we have winter, and then we have pre-spring. So in green, we have geomagnetic activity. From a few days before the beginning of the vernal equinox, the first day of spring, we start to see, or it's just after that, we see that geomagnetic activity starts to rise. And adrenal activity is at a baseline level, and thyroid activity is declining. So what I want to show you is a particular pattern which exists except in pre-spring, which is that thyroid and geomagnetic activity tend to be inverse to each other. Because the more that we're nourished with the geomagnetic output from the earth, the less we need thyroid activity on average, because we're receiving this external energy to help power our systems. So what happens in the adaptation to summer? There's a natural rise on average in geomagnetic output. And to help the organism adapt to summer, there's a brief rise in adrenal activity, which then significantly falls. And the same thing is true of thyroid activity, because remember, for most of the year, it works inversely to geomagnetic output. Now, during this time of summer, we have the peak of geomagnetic activity, and we have the lowest need for adrenal and thyroid activity because we have such a strong level of geomagnetic activity to help modify the magnetic and electromagnetic functioning of our body and how that affects our metabolism. But what happens as the days become shorter again, and there is a demand to prepare for autumn? There's a pre-autumn adaptation. We see the geomagnetic activity in green starts to decline. And as always, during these intermediate periods, you see a boost, a rise in adrenal function, ideally, because this helps prepare the organism for the change in the level of metabolism. And you see again that there's a commensurate rise in thyroid activity here at the bottom of the screen, which is inversely related to the gentle decline here in geomagnetic activity. And then we have the autumn time, and the geomagnetic activity starts to fall more precipitously. And the adrenals, which have substantially increased their level from summer, now should be equilibrated and functioning at a generally higher level than you would see in the spring. And again, we see a commensurate rise in thyroid activity in response to the geomagnetic fall. And now we have the need to adapt the organism for winter. And geomagnetic activity continues to fall. And once again, we see a rise in adrenal cortex activity, which then levels off. And as you might suspect, there is a commensurate rise in thyroid activity. So now as we're entering into the dark days of winter, this is all for the Northern Hemisphere, of course. We are at a point where the dependence on the thyroid activity is exceeding the geomagnetic. And adrenal and thyroid activity are functioning pretty much at their highest as a concerted group of activity, as you see here. They're at their peak because geomagnetic function is at its nadir, and the exposure to light is at its nadir, and the exposure to darkness is at its zenith. But now we're going to come to this special situation of the pre-spring adaptation, which actually began just a few days ago, which makes this a very relevant topic. Everything I just said pretty much goes out the window. So you see how there's a rise of geomagnetic activity on average from now until springtime. While we do have this adrenal adaptation, what happens to thyroid is really the issue here. Because you see here, we have a drop in thyroid activity while adrenal is rising. So that's different. Because in all these other times, like here, you see in the pre-autumn and the pre-winter, with each of these boosts, there was some type of relative increase in thyroid activity, but not here. And look at their gap. And now you see what happens is you have this one period of time right here where thyroid activity is increasing, and so is geomagnetic. So let's start to look again at the normal physiology of adaptation before we come to understand these disadapted states. So we can talk about two subphases, okay? We're going to talk about this phase here, and we're going to talk about this phase here. So here's a close-up of what I showed you. Here's February 18th. That was a few days ago. Okay, we have this boost of adrenal activity and a drop in thyroid activity while geomagnetic activity is increasing. So in subphase 1, we have an inverted adrenal thyroid relationship, as I mentioned. One is rising, the adrenals, the other is falling. So cortisol rises in particular. Why? Because it's increasing catabolism and allows for the release of accumulated toxins, most of which were stored in fat cells during the winter. There should be a slight decrease in the anabolic steroids in the adrenal cortex, and this allows catabolism to predominate. And you see this drop in thyroid functioning, which avoids over catabolizing. Because if you had a rise in cortisol and a rise in thyroid hormones at the same time, you would go into too intense catabolic state here. That would not be helpful, because then you'd start to catabolize muscle rather than fat, for example. And it's also to prevent a metabolic strain on cells, because the major sink or recipient of thyroid hormone activity should be within the emunctories, like the liver and the kidney and the intestines, in order to process the toxins that are being released from the body. And when I say toxins, I'm not only referring to exogenous toxins from the environment, but also endogenously produced toxins just from metabolism. Now, in subphase 2, we're dealing with this point here. And again, we're just talking about physiology, not pathophysiology. Remember, what's happening is we have a special case of thyromagnetic predominance, because you have rising thyroid and rising geomagnetic during this brief peak, and you have this fall in adrenal activity. So again, it's the only time that thyroid and geomagnetic activity increase together, and the only time that thyroid predominates over the adrenals. So those of you who've studied endobiogeny will know that there's an index called metabolic yield, which is looking at, it's modeling the average rate of metabolism throughout the body. And there should be a surge in the metabolic yield at this point with maximal ATP production for emunctory drainage and detoxification. So now let's look at something like spring hypoadaptation, where there's not enough of adrenal function. This is going to put people at risk of retaining these toxins that have accumulated or retoxifying certain organs as one organ releases toxins, but the liver or kidneys, for example, cannot accommodate them. And so maybe these toxins now get deposited in the joints, or they get deposited in the lungs or in the brain. And other tendencies you might see are a certain type of allergies that's more eosinophilic in nature, a wet bronchitis, depression. So I'm going to speed through this part so we can focus on uh, where the pathophysiology is in this case. Okay. So now we're going to pay attention here between these two gray lines. So the geomagnetic activity goes on like it normally does. And so does the thyroid, okay? It has the drop, it has the peak, and then it goes down again, opposite to geomagnetic, which is how it functions the rest of the year. But let's see what happens to the adrenals. Okay, we're going to focus on this green box. The dotted line represents what should have happened. Okay, this is physiologic. We would have expected this bump up and then a drop. But instead, we see this. We see a drop in adrenal activity that slightly recovers. Okay, so we don't have this ability to start to mobilize the toxins. So here's a close-up of what we just looked at. Again, this would be physiologic, the dotted line. This is what's actually happening. So if you did a GEMMA allergy panel right now, you can order a CBC, or maybe you already did for your patient. It'll come back in a day. Just run the panel and see what it is. If your patient has a history of allergies, it'll probably say that there's a global allergic risk that's present and you need to validate it clinically. Let's say your patient has not started to show signs of allergies, but their eosinophil to monocyte ratio is high and the allergic risk is there and their histamines are elevated. That means that they probably don't have hepatobiliary congestion yet, excuse me. And you have a chance to focus a simple treatment on liver gallbladder drainage. And you can also improve cortisol activity. Those of you who've studied with us, or just as a quick refresher, spasmophilia is this dysfunction in the transition from para to alpha to beta sympathetic. And you would expect to see or could anticipate some spasmophilia where you'd want to use something like hawthorn or German chamomile. And there could be some indications of hepatosplenic congestion, and there'd be some different plants you'd want to consider. So let's actually look at a panel so we can take this theoretical approach and apply it. So here's the patient. Isn't it incredible? Their name happens to be I love endobiogeny. But here's a 33-year-old female. And in the allergy panel, you see in section 1, which is the results, that their global allergy risk for acute allergies is 33. So it's already elevated. And their histamines are quite elevated, over 400. And they have a lymphocytic predominance, and they have an eosinophilic predominance, which you would expect in a classical allergic pattern. Now, if your patient already has allergies, you can start treating them. But let's say in the face of these results, they actually are not showing signs of allergies yet. Well, it says right here, if the patient is asymptomatic, they're at risk of allergic flare when exposed to allergens in the context of hepatobiliary congestion. So if they're not allergic yet, they're either not exposed to their environmental allergens, for example, like maybe it's a plant which blossoms in April or May and not in February or March, or they haven't developed hepatobiliary congestion yet. So again, you have this chance to treat them. So for each of these results, there's an interpretation that's specific to this result and this level of result to explain what's going on. And then in the next page, you would see this treatment section, which gives you a summary recommendation of your overall therapeutic strategy, a complete low histamine diet, and I'll show you that because we have a handout included for free in this panel. And I've highlighted in the same color a couple of treatments that repeatedly come up. Rhodiola comes up 3 times. Blackcurrant as a chemotherapy comes up twice. Burdock, wild pansy, which we talked about earlier. You could consider birch, vitamin C, quercetin, thyme essential oil. That actually came up twice. I didn't highlight it here. So you can create a pretty simple treatment that is really polyvalent and going across the system. Here's the handout that you can give to your patient to save you time on a low histamine diet. It talks both about foods you want to encourage them to eat, as well as foods to avoid. And there's 3 levels: foods that are rich in histamine, foods that block the diamine oxidase and slow down breakdown of histamine, and foods that trigger histamine release. Okay, so you can also have a spring hyperadaptation. So let's go through this animation quickly again. And let's come to this time. Okay, so we're focusing here on the right side and inside this green box. So in this situation, the adrenals respond perfectly appropriately, as you would expect. This is how thyroid should function in the dotted line, but this is what happens. So let's talk about this. There was an under response from the thyroid initially. And the compensatory adaptation by the hypothalamic and pituitary thyroid trophins, TRH or TSH, overstimulated the thyroid. Okay? So now you have this over response. And let's see what happens here. You could look at a thyroid functional level. So again, how would you know which panels? Because you need to know your patient's history. There's a certain type of allergies with a more of a monocytic predominance, and I'll talk about that. They could have psoriatic arthritis, psoriasis, eczema, various autoimmune conditions that flare up at this time of the year, because a lot of these are implicating the thyroid system. You could order a thyroid functional level 2 panel. This is TSH, free T3, free T4, LDH, and creatine kinase. And you might see something like overactive central thyroid kinetics with a free T3 excess. And if you went through the panel, maybe you'd see that your T4, T3 ratio is low. And you might want to use chase tree to slow down the rate of conversion of T4 to T3. And your thyroid index is on the higher end of normal. And your thyroid yield is high, which means even though the functional activity of thyroid hormones at the level of the tissue is in the normal range, the thyroid responds too quickly every time TRH or TSH stimulates it. And so if, let's say, thyroid needs to be increased at a certain time of the day by 10 units, it's increased by 17 units. That's what thyroid yield is saying. The spurts and the peaks of thyroid activity are too exaggerated. So you might want to use something like motherwort and stone seed. You could use lithy tree as a gemotherapy. You could use peachy, which is Fabiana and Bricata. You could also, again, just stick to the allergy panel if you're really not sure or you just had a CBC. And while the allergy panel would be the indication of allergic risk would be present, it would be because the monocyte to neutrophil ratio is high, in which case glutathione would be indicated. And of course, you could use pansy or burdock plus or minus quercetin. So again, how do you know when to use glutathione? How do you know when to use rhodiola or this or that? The panel will rationally recommend some proposals to you to consider. Well, this concluded really this brief introduction to spring adaptation, and I hope you have some very practical things that you know that you can do. Find these patients with a history of psoriatic arthritis, of psoriasis, of autoimmune flare-ups, of allergies that occur sometime between now and May. You just start with an allergy panel with the CBC. You can add an adrenal panel. You can add a spasophilia panel. With that same CBC, you can order multiple panels and start to get a really deep level of understanding. And you can start to use these various interventions that come up specifically for your patient's needs. So in summary to this section, the earth and all organisms on it have an internal rhythm that adapts to the external rhythms generated by the earth's revolution around its tilted axis and its rotation around the sun. The interplay of geomagnetic and hormonal factors allows for regulation of metabolism in the face of these changes. And disruption of this interplay during the pre-spring period of adaptation can result in under or over adaptation and various disorders. So in the susceptible terrain, again, even if you have these changes, if the emunctories are not congested, the patient may not end up expressing these disorders, or they might have a milder case. But in the susceptible terrain, disadaptation favors various disorders. Okay, so this concludes the lecture, and if there's any other questions, I'd be very happy to answer them at this time.
I'm not able to share a video, but maybe it's not a problem. I
Yeah, I'm looking at the thing. Let's see. Thank you for your kind comments.
There is a question that came in the Q&A box, and how can we regulate better gut-brain axis for the springtime period? Uh, so I guess it's just if you can talk about gut-brain axis for the springtime and for some in the broader sense.
Sure. Well, in the period that we're in right now, let's say until the first week of March, it would be helpful to reduce high glycemic and high fat foods because that's going to put a strain on the liver. It would also be helpful to use adaptogenic plants such as rhodiola or ribes nigrum. So even if you're not using the GEMMA testing system and you're not sure what the adrenal gland is doing, by using adaptogenic plants, which allow it to increase low activity or decrease excessive activity, you're going to have a good start. You can also start to use the tradition that we find, for example, in Eastern Europe and the Baltics, which is to start consuming birch sap around this time. Because birch sap, especially if you can get it without sugar, because birch sap is a wonderful cleanser that you can start to use. Okay, let's see. Somebody asked, Jenny asked if the lectures will be recorded. Everything will be recorded during the course. If you miss a course because you're traveling, because there's a wedding, a graduation, you didn't feel like getting out of bed, it doesn't matter. Whatever, if you miss a course, it's okay. It's going to be recorded. You can catch up on your own time and 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 it's going to be okay. We have another question from Dalbor. Can you present us with a difficult case you have solved through endobiogenics? Well, there'd be so many. I think we'd be together for a couple of weeks. But I think as we start to go through some case studies using the JAMA panels later on in the course, we'll start to do before and after and learn how to compare and learn to do this longitudinal following. So, but we do have a number of old webinars that will be made available to the students who sign up for the Science of Endobiogeny course. You can look at the case studies we presented there for sure. All right, I know that we've kept you for quite a bit. I'm so happy for your ability to join us today, and I hope that all of you will join us for the Science of Endobiogeny course. Um, if you look at the testimonials and you talk to those who've taken our courses, you'll see that this is not just a class, this is a fellowship in the truest sense of creating a sense of community. And when you take a course with one or more people that you're in the same practice with, or that you know, you're much more likely to complete the course because you can support each other. And as you start to study, you meet other people in your country or other countries, and you start to form friendships because you find that somebody's really good at treating, for example, infertility, where somebody else is really good at managing pediatric cases or autism specifically or something else. And you start to refer patients to each other and you start to collaborate. And even if you don't do any of that, I have so many students as they fly from the East Coast to the West Coast of the United States or from one country or another, they stop by and see their endobiogenic colleagues and they catch up with them. They have a cup of coffee, they have a cup of tea. This is a life-changing course because as you change your life, you change your practice and you change your whole worldview and the people that you'll be calling your colleagues from this point forward.
And I would like to add that one of our students, I believe, said very nicely that the world needs more endobiogenies because patients need endobiogenies. Patients need endobiogenic understanding of what they are going through. There is more and more illnesses that occur in this world and at the physical level, but also psycho-emotional level. And endobiogeny has this power to address all of that and with a lot of treatment options. So we have a mission, not only as a physicians to for our own interest and education, but also to help people.
I'm just going to quickly answer
Mhm.
Sarah
Yes.
Hennessey's question. With mast cell activation syndrome, she said sometimes people react badly to N-acetylcysteine. And would it still be safe to use glutathione? When you take the course, or even you just start using the JEMMA panel, you'll see many alternatives for mast cell stabilization. Well, first of all, the sulfur moiety in N-acetylcysteine tends to be irritating to maybe 10% of people. The Even though glutathione is derived from N-acetylcysteine, the sulfur moiety is much more stable in glutathione than it is in N-acetylcysteine. Even if you don't want to use a sulfur-based compound, you can still use lavender to stabilize the mast cells. You can still use burdock and many other choices. So absolutely don't worry about it. In endobiogeny, you'll see that vista of all the choices that are available. And you know your patient, we don't. That's why the panels don't say treat with this single treatment. It says here are many options categorized by medicinal plants that have a primary neuroendocrine action, a drainage action, amino acids, vitamins, minerals. It's your choice. You know your patient. You're the expert. Wonderful, Julian. Yes, Julian has been practicing endobiogeny for almost 30 years, and we've all been better for it. Well, I know we could go on for a long, long time. Thank you to everyone. I look forward to seeing you at the course. And when we have a critical mass and a critical movement across the world, we can really start to change uh, not only the health of our patients, but the mindset of our society and healthcare writ large. We'll see you soon.
Yes. Let's stay
Good.
in touch.
Yeah.
Bye
Okay.
bye.
Bye for now.